Hi from Navy Medical Center, San Diego. My name is Eamon O'Reilly, and today we're discussing Dr. Ian Valero and colleagues' article on flap coverage outcomes following vascular injury and repair over the decade-long war experience in Afghanistan and Iraq. This has become a pertinent topic in the last few years, mostly because of the upgrade in body armor and the use of improvised explosive devices overseas. This has led to an increase in extremity trauma, often, as you know, with severe injury, as measured by such topics as the injury severity score. In that setting, Drs. Casey and Drs. Valerio looked at vascular repair on these patients with these extremity injuries prior to flap coverage and comparing them with a cohort of patients without prior vascular repair. There are two groups of patients, one approximately 80 patients and one approximately 230 patients. The smaller cohort, the 80 patients, underwent prior vascular repair either in theater, in transition, or at a military treatment facility in the United States. Those two groups were compared, and the primary outcomes of which ultimately were limb salvage and amputation rate. It turns out that both groups had very similar limb salvage rates and very good flap success rates. Flaps were used following vascular repair successfully in 92% of patients who underwent prior vascular repair and 90% of patients who did not have vascular repair, which is not statistically significant. In reference to the results, the authors provided a few tables that are excellent. The first one is comparing the 78 patients versus their extremity injuries, looking at their average age, which is similar, average injury severity score, which is similar, the male, 100% of the patients, and mechanisms, the majority of which were blast injuries. Additionally, the two groups were compared in Table 2 with time to flap, which is similar, the number of procedures prior to the final definitive flap coverage, which is similar, and then ultimately the types of flaps, whether it be pedicle or free, or muscle and fasciocutaneous, all of which were not statistically significant. And then finally, looking at the complications of the groups, Table 3, the vascular injury group and the no vascular injury groups all had similar complication rates. And of note, while the overall failed limb salvage rate was similar, all these patients, due to their multi-system trauma and complications of high and low velocity wounds, did have high complication rates to include infection and hematoma. Why is this article pertinent? For two reasons. The first reason is that this proves, just like other literature, that prior vascular repair, even in the severely injured patient, does not prohibit flap coverage of complex wounds. Second, this proved that there was no increased rate of amputation following these repairs. Therefore, it is a worthwhile endeavor in our young soldiers to proceed with flap coverage in these mangled extremities, even following vascular repair. I think Drs. Casey and Drs. Valerio add an excellent body of evidence to this literature, and in fact, it's the largest series ever looking at vascular repair and trauma and flap coverage, and I have a feeling that this will be used in years to come to reference many repair in many hospitals in the United States. And it just goes along with the excellent body of literature that they're contributing from the war experience from the global war on terror over the last 10 years. Thanks. I hope you enjoyed the review.